Okay, thank you very much. Good afternoon to everybody. So my name's Helen. I'm one of the trainee consultant scientists in Nottingham, and our quality improvement project is centred on achieving quality and timely EEG recordings. Next slide, please. So our aim was to achieve full quality and interpretable EEG recordings in 95% of all children and young people that an EEG was requested for, and we were hoping to do that within 4 weeks of referral as per NICE guidelines. We see a fair number of patients with intellectual disability, autism spectrum disorder, and also neurotypical patients who are very anxious and nervous about having an EEG. And it seems to be these patients that we sometimes struggle to achieve a quality EEG on. So we made them the focus for our quality improvement project. We used a variety of tools to fine-tune our focus for the project, including driver diagrams and fishbone analysis. But what we found most useful was a 5 whys methodology and a patient questionnaire. We thought that one of the problems in achieving a quality EEG might stem back to poor preparation even before the patient walks through the door. So patients already receive a children's leaflet explaining the test, and we do send out cue cards for our autistic patients, which are mainly a picture guide to the test. But apart from that, we thought there was little information or an avenue for families to ask questions before they came to help alleviate the stress and anxiety that the children were facing. We also started giving questionnaires to families with the cohort of patients after they'd had an EEG, so that we could gain feedback and fine-tune the project. So the top pie chart on the left, if we can just highlight that. So we asked a variety of questions, but it was 3 real questions that we found useful. So that first pie chart asks where you'd like the test to be performed, and 60% of families still wanted to come to the hospital. The second pie chart, if we can move on to that, we asked, would it be helpful to ask questions before coming for an EEG? And we had a huge chunk of 44% said yes, and they'd really appreciate a phone call. And then the third question that we were interested in was that we asked, what information would you like before coming for the test? Now, 25% said a leaflet, which is what we already send out, but more people, 31%, actually said that they would really appreciate a phone call. So if we can have the next slide. So all this information led us to perform 4 PDSA cycles, so plan, do, study and act. Our first PDSA cycle was fairly straightforward, so we dropped our breach date from 6 weeks to 4 weeks. And we charted how many patients were seen in this 4-week window. For our second cycle, we selected one patient whose referral had stated autism, and we telephoned mum the day before, and we discussed needs and anxieties and ways of working that might lead us to get a good recording. Things like bringing the favourite DVDs, the room layout, if they thought staff in a uniform might be an issue, whether a plain room would be better than a room that was quite overstimulating. The patient then came the next day. We got a really good recording, and we had fantastic feedback from mum saying that she really appreciated what we'd done and that kind of personal touch with the phone call. So because that worked so well, we moved on to our third cycle, and we rolled it out to all of the patients that were referred that had ASD or intellectual disability. This worked really well, and the results that I'll show you on the next slide speak for themselves, but it was very time consuming, and the logistics of making it work were fairly unfeasible. It also meant that we were missing the neurotypical patients that presented with anxiety and nerves. because that wasn't documented on the referral at all. And so because we were seeing so many paediatric patients, we felt that making the phone calls, although it was a lovely idea and very personal, we felt like we needed to do something else to still get that information to the patients, but do it in a different way. So that led us to our fourth cycle. So we created an additional flyer that went out with that patient leaflet that we'd already got in place. And that addendum, that additional flyer, signposted useful resources. So we told them about the great video coming for an EEG that the Evelina Children's Hospital have got on YouTube. Also, a few years ago, we collaborated with the adult learning disability team here at Queen's at NUH, and we created a leaflet and a video. So that was quite good because patients could actually see what the department looked like before they came. So we included all the information on that addendum that we would have talked about over the phone. So next slide, please. So these are our results. I'm hoping that you can see them okay. So if we concentrate with the top graph to start with, you can see where we did our EQIP training in November 2019, and then the following PDSA cycles and the results. So we had a fantastic improvement in the number of quality EEGs that we were getting, and we actually hit 95% and better month on month. That PDSA cycle 4 was when we introduced the information leaflet and stopped making the phone calls. But that was 2 days before we went into lockdown, and after that point we were only seeing the urgent outpatients. Although our results look great over that period, we obviously had a major reduction in the number of types of patients that we were seeing. It might be that we were seeing far fewer patients with intellectual disability and ASD because of shielding or because of comorbidities, or the fact that they didn't fall into that urgent outpatient group. From July and August, we're pretty much back to seeing all of our patients. And I wonder if we're seeing relatively more of the patients that we're interested in now. So you can see that we've had a blip down in our August figures. So it will be interesting to see whether that is a one-off or whether we can track the results further and see whether we can improve back up to 95% again. That bottom graph of wait time speaks for itself. We started well. We had a few dips in wait times when staff used annual leave around Christmas, when we had some reflooring and we had fewer recording rooms available. And then obviously COVID-19 has had a major impact on our wait times. The results have been fairly variable over the last few months because we've still been seeing urgent outpatients, and we've been able to see them within 1 or 2 weeks because we haven't been seeing all of the other patients. But our general wait time, it was up to 20 weeks when we first started opening our doors again, but we have got it down to I think 11 weeks now. So we are improving, and hopefully we'll be able to get back to where we were fairly soon. Next slide, please. So to summarise, our successes have obviously been in our quality recordings and the great feedback that we've had from families. So we've had families saying what a great service, what a great idea. This is 100% better than when we came last time. We've made some great collaborative links, and the multidisciplinary working has been fantastic. We've been sharing challenges and ideas for individual patients, emailing ideas around, you know, could we do a melatonin patient, a double slot, and the consultants that we have in the community have been really good at communicating what they think might work for individual patients. It's also inspired other ideas in the teenage clinics. We heard about the Ready, Steady, Go earlier, the transition support from children's to adult services. and virtual consultations and the phone triage that's been happening during the lockdown as well. So that's worked really well. Challenges. Obviously we had the time constraints to ring and telephone families or carers the day before, although it was lovely and they really appreciated it. It wasn't time efficient, it wasn't feasible to do it. We did have a plan to contact families and carers after the EEG for feedback, but again, sadly, that didn't happen. And obviously the pandemic had a huge effect, mainly on our wait times. The future, I've got about 5 email addresses of patients who said they would be willing to get involved with the service user forum to explore further ways of meeting the needs of our children and young people. And that might actually work really well now that everybody's used to Zooming and using MS Teams. So we might be able to do some group video conferencing, which might help in getting everybody together. And we're also working on a child-friendly video as well, set in our department, and we're going through some charitable funds at the moment to try and get that up and running. Last slide. And so I'd like to say a really big thank you to the rest of the team. We came from different areas. We obviously have the consultants, specialities in epilepsy. We had the specialist nurses, and we obviously had clinical neurophysiology input as well. So we had 2 scientists involved. So it's worked really, really well, and we've really enjoyed it. So thank you.